Good morning, my YouTube viewers. It is Palestine here. I'm making this video because I just wanted to let you know that I've received the results from the chest CT scan that I had about 2.5 weeks ago. And I'm not going to read it all, but it was a CT scan of the chest. And they're saying that there's no evidence of lung cancer, so I don't need to have any more tests done with that regard. But they said that they're going to review me, they're going to give me a CT scan every 2 years. I think in approximately 24 months, they're going to contact me to offer me further screening appointment, and said please do attend the screening appointments, as early detection of lung cancer, it makes more treatable. And then so basically I was reading something somewhere, or I saw it on a poster in the hospital, or I saw it on a YouTube video, but they said that breast cancer is the leading cause of death, leading cause of cancer in women after lung cancer. So apparently lung cancer is more prevalent than breast cancer, which is something that I didn't know. And so I guess that's why they're screening me for lung cancer, because lung cancer has a higher incidence than breast cancer. And that's just what I was reading something, or on a YouTube video or social media or something like that, saying that breast cancer is the leading cause of cancer in women aside from lung cancer. Another thing that they said was that I have mild coronary artery calcification, and they said that I reported I was not on any medication for this. So they said that I need to see my GP to assess my cardiovascular risk, complete a Q risk score with consideration of prescribing medication such as a statin. So I've recently been prescribed a statin, but I'm not taking statins right now at this minute. And the reason why is because I have to get my prescriptions renewed every month, because I'm not trusted, because the UK government says that I'm mentally ill, and because of that I have to get my prescriptions every week instead of every month. And then in addition to that, in order for me to get my prescriptions renewed, I have to send an email to my GP surgery every 4 weeks or every month saying that I need to have my prescription renewed. And the last email that I sent, I forgot to put in the statins and the vitamin D. So in this particular instance, I'm not getting my statins and my vitamin D because of what I did, because I forgot to put it on the email. But in the most recent email, because I have to renew my prescription every month, my most recent email, I did actually request for statins and vitamin D, because I need vitamin D as well, because I'm low on vitamin D. Even though I walk to work, I go outside every day to walk to work, I guess that still isn't enough vitamin D. So I just wanted to let my viewers know the outcome of my CT scan. And I did want to say that I'm not sure exactly what the CT scan tested for, but if it could pick up mild calcification in the coronary artery, I'm guessing then it could pick up a tumor. So maybe, possibly, my concerns about the breast cancer, maybe I was just worrying too much. But I do have pain And in addition to that, there's great orange peel skin close to my nipple, so that is present. And I still have pain in my ear and my neck and my shoulder. So I'm not sure what's going to happen in that regard. But basically, I'm not a healthy person. Now I'm going to have heart disease. Now I've got calcification in my heart, and they're telling me, oh, well, we want you to lose weight. Yeah. They give me drugs that I'm required to take. Like one of them is anastrozole, which makes you gain weight. And another one is, it's a mental health medication. Pretty much all mental health medications make you gain weight. So on the one hand, they're telling me to lose weight, and then on the other hand, they're prescribing me medication that makes me gain weight. And in addition to that, a long time ago, I was reading somewhere that said that when women go to menopause, they start having heart problems. And because the estrogen keeps you young, estrogen is what keeps a woman young. And so when the woman stops producing estrogen and she goes through menopause, then she's going to pick up heart problems. Well, not only have I gone through menopause, and even in menopause, your body is able to produce estrogens, take androgens and convert them to estrogens. But I'm given this drug called anastrozole, which actually prevents my body from making any estrogen at all. So I don't know if I would have had this calcification in my coronary artery anyway, or if the calcification has come up since taking anastrozole. I don't know. I do know I haven't got any statins at the moment because, as I told you earlier, I forgot to put that in the email. And I've not got any vitamin D at the moment because I forgot to put that in the email soon. But hopefully, I'll get my statins and my vitamin D soon. So hopefully that will do something to correct this calcification in my coronary artery. And this is a good point to say that my grandfather, and he was in Arkansas, he was in Ensley, Arkansas, he actually died of a heart attack when he was 72. And then I have my cousin. She actually has had a heart transplant because she had a heart defect that was very hard to detect. They had to send her heart to Mayo Clinic, and Mayo Clinic found that she had a heart transplant. So, the heart defect. So, my cousin has actually had a heart transplant. But I don't have a lot of contact with my family, and the reason for that is because, number one, I'm living in another continent, and number two, when I was harassed out of my job at Foster Wheeler, what they did was they caused problems with my family as well. And so I'm just pretty much here on my own in the UK, and all I have is my boyfriend. I don't have anybody else. So I think I'm going to go ahead and conclude this video because I've given you the outcome of my CT scan. I've told you I don't have lung cancer, but they're going to test me again in 2 years. And then I do have calcification in my coronary artery, and also forgot to put 2 drugs on the email that I have to send every month to my doctor's surgery to get my prescription renewed. So that concludes this video. If you like my video, please like and subscribe, and I will be making another video for you after Friday, when I've had the appointment with the breast doctor, and he can look at the orange peel on the right side of my left breast. It's not as bad as it was. So, and also, I just think that if there was a tumor there, then the CT scan would have picked it up, and the CT scan didn't pick anything up. So we'll just wait and see what has happened. So maybe I'm a little bit relieved about my breast problems, but now I have to worry about my heart. So thank you again for listening, and I will be making another video for you when I've had my appointment with the breast doctor.